Okay, so hello everyone. Welcome to another longevity primer series hosted on behalf of LongX. At LongX, we aim to expand access to longevity education and learning opportunities globally, ensuring the future contributors to the aging field come from the very best of every country, regardless of your access to local opportunities. I'm very excited today to introduce Patrick Burgermeister. Just a little bit about him. Before founding RegenEra VC, Patrick acted as a partner for Kizoo Technology Ventures, a family office investing in early stage longevity biotech companies. You may very well know Kizoo portfolio companies such as Elastrin, Cyclarity Therapeutics, Revel, or Selvi. Patrick also heavily supported the Berlin Rejuvenation Startup Summit in the past couple of years, turning it into a key event in the European longevity scene. Prior to Kizoo, Patrick was a partner at the venture capital group BioMedPartners in Basel, a leading European investor in private life science companies. Both in the past and today, he supports young companies as a member of their board. So, Patrick, thank you for joining us, and I can't wait to hear from you today.
Brilliant. Thank you for having me. And thank you also, Denisa, for the invitation to speak. I've been given full freedom to talk about whatever I want. And I thought it may be most interesting if I share my personal story into and within the field. And also, please feel free to interject at any time with questions or burning remarks that you may have. This needn't be a monologue, or even though it's a foreseen that the first part is my speech, so to say. Um, don't be shy and just let me know if there's something I should elaborate more, explain, or if you have a remark on something. Good. So maybe to begin with, where was my first exposure to longevity, or yeah, to to our own how I say, limited existence. I think life is limited in time, and I asked my mother, why is that so, and what do people do, and etc. And she sent me to my grandfather. He was the big and large figure in our family, very knowledgeable. And he was, thankfully, he was not giving me, for example, a religious answer that, oh, don't worry, there's always a life after death, and follow the rules or enjoy life or whatnot. He was very upfront and said, yes, there's nothing that can be done about it, and that's human existence, nature, etc. And with that, I went home, and I still remember that I lay down a couple of times trying to imagine complete nothingness, death. I tried hard, and it was extremely frightening to do that. And maybe that was the gripping point. It was about the same time when I eagerly watched the series Cosmos from Carl Sagan, the astrobiologist, he called himself, about how galaxies are born, how evolution functions, and all that. So I think that's why I got the virus of science at the beginning. Um, I followed that. I studied twice, maybe a bit overdoing it. Business administration, looking back just to get the degree, I guess. And then with fervor, molecular biology. And I was always most interested, obviously, in human diseases, how to treat them, and maybe even how to cure them if this is possible. So when I finished my degree in molecular biology, I had the goal of becoming a scientist. I worked in an Alzheimer group, clearly a unmet medical need, and maybe the most dangerous of all the diseases out there. There may be methods to replace kidneys, hearts, etc., to substitute or obviate some of the diseases. But if your central nervous system, if your brain gets sick, if you get dementia, then yeah, that's pretty much it. I then steered away, having 2 degrees in business and in science from this field because somehow I realized research is extremely difficult. You are forced to publish whatever you do, positive results, but also negative results. You're constantly on not long-term jobs. You get another contract for maybe 1 or 2 years. You get financed there, etc. I thought maybe it's better to influence where money flows. So I leaned a little bit more on the finance side. And one of my first jobs was actually being a biotech analyst. These are the people that sit in a bank and analyze the stock market. I was responsible for large companies like Roche, Novartis, AstraZeneca, GlaxoSmithKline, etc., and thought if I tell the people exactly where to invest in, this would somehow influence their decision or so. However, I was there for 3 years. It was quite exciting. It was the time when the Twin Towers collapsed. So I saw a very strong bear market, but also a rally after that 2 years later. I also realized when I looked into the Bloomberg terminal, these are the computers that bankers use often, that I was, I think, analyst number 35 or something like that for one of these companies, big, large pharma companies. And I also thought at one point that maybe it's just a marketing tool for the bank to have a molecular biologist on the chair for the biotech analyst, because if you make money on the stock market, it's actually just a change of ownership. Some people invest here and others lose there. It's not really influencing innovation, new drugs coming to the market, making a difference against human diseases. So that's when I applied and got a job at Novartis and became a portfolio manager. This was a small group of 5 people. What we did there is we ranked the whole development portfolio from a preclinical stage all the way to regulatory stage when drugs are being filed for admission to the market. We had a lot of tools. Most important of them was probably the net present value, where you try to calculate the future profit of a drug that you're developing that is currently still in development, and other measures. Large companies tend to be very slow, of course. I realized that as well. And I remember having 4 different committees to convince if you wanted to push a drug for development. It was finance committee, development committee, the executive committee, and the 4th one was the business development committee if the drug was in-licensed. So yeah, a little bit disillusioning. Already then, I had the idea that maybe venture capital, that could be the best combination, not only of my 2 backgrounds, but also to foster innovation and to make maybe even longevity drugs in the future. I was actually planning to join the business development team of Novartis because I thought that's a necessary requirement to become a venture capitalist. And maybe one advice here already: speak to a lot of people always. Don't be shy. Network as much as you can. I told everyone who didn't run enough fast enough that I'd like to become a venture capitalist one day. And it was only after 2 years at Novartis that I got a phone call from a lady who I knew before. And she told me, oh, Patrick, didn't you say that you want to become a venture capitalist? I was getting very excited. And then she said, yeah, I know of a job. There's an open position. And while she said that, I was hedging my expectations because, okay, now she's going to tell me that this is somewhere in the West Coast, on Australia. It can be anywhere, right? And she told me, it's in Basel. That was actually the city I was already living in. So that was like, yeah, pure luck. This was in 2006. So I joined this venture capital group, 5 people. Um, However, they were restricted to European companies. The first fund, and I can explain a little bit more if you wish, how venture capital functions. The first fund even had the label Alpine Rim in its title. So it was very local. I guess what is Alpine, Switzerland, Austria, Germany, not France also, not much more. It grew. It was quite successful. The second fund then was already Switzerland, was all neighboring countries. And the third one was including the Benelux, Belgium, Netherlands, and Luxembourg also. So it grew steadily. However, I realized that the US is a very important market because they adopt, for better or worse, a lot of things first. This was also the case, still is actually, for longevity. And even the things that I was able to invest in at Biomed Invest, that's the name of the fund I worked for and became a partner with. Whenever I looked at a company, you compare it, of course, with other companies that do the same thing, that may be in the same stage, have the same disease that they try to treat. And if you then have 5, 6 companies that you look at, you realize the 3 most exciting may be outside of the geography that you're able to invest in. So you realize that every geographic restriction actually limits your potential also to, yeah, to make money in the end. Then before I go on and tell you where I went next, I have to tell you that my time at Biomed Invest was interrupted. I went out for 3 years and was invited back. Maybe I did something right in my first time there. And I was in these 3 years, I was a business developer for an oncology company in Vienna, actually. So I also learned the other side, which is always good, of venture capital. I went fundraising with this company, and it's really difficult and also different because you have maybe one asset, maybe a very small pipeline, and you have to defend that with all your might. If you're at a pharma company, you can think like an insurance guy. You kill one or the other project just to optimize your risk profile, etc. Even as a VC, you can maybe exchange the team, say, oh, this CEO didn't deliver, so let's exchange her. But if you're with a startup company, you have to fight for your product with all you can. And also you realize that if you're fundraising, going to VCs, how high up a chair they sometimes sit. They don't respond to emails, they let you come, present, and then don't give you feedback. I experienced all that. So it's really tough if you're with a single company. In between, another short digression, I did whatever I could to help the field in a way. You may have heard or know that I'm the translator of Aubrey de Grey's book Ending Aging, which came out in 2007. I found this is such a brilliant book, and the first actually that really explains what categories of aging there are and how we can treat them today or what should be done in the future to really tackle them. So in a way, he was 6 years earlier than the hallmarks of aging. I also helped set up a network of European countries to which you could donate, which were then tax deductible for the Sense Research Foundation. Then after this time at Biomed, I found my vocation in a way. I joined Kizoo, the family office that Aiden has mentioned at the beginning in Germany. Pure longevity investing, drug development, and global. Exactly the 2 things that I consider very, very crucial to do. And it was also very exciting to have such short decision-making processes, because it was the money in the end of a single individual. And if Michael said yes or no, then that was it. Not for committees, not weeks or months of debating or due diligence, etc., endlessly. And in the next 5 years, that was until 2024, um, I was able with this team to build up a portfolio of 15 companies. About six of them were considered key, so with large amounts of investment, with participation of the board. So I was actually one of the directors of these companies. And I became quite vocal. If you listen to one of my talks during that time or panels, I thought a family office, and for those who do not know that term, it's an institution that manages the money of a family. That's where the name comes from. And in this instance, it was a single individual. A family office has a so-called evergreen structure. This is the term that finance people use to describe that it's not dependent on a time horizon, like actually most venture capital funds out there are. Most of them need to give back their money after 10 years, which for most investors is already very long. So if you're fundraising for a fund, they tell you, oh, can't you give it back after 5 years? Or, no, no. I mean, we invest in preclinical companies. That's how long we need the money for to create a return, to maybe sell these companies or bring them to the stock market. Evergreen is the opposite. It's a very luxurious setup, and the family office has that. And I was becoming convinced that for longevity, drug development at least, I'm not an expert in supplements or in diagnostics or other fields. This is the best setup. However, last year then Kizoo changed strategy, and I decided to leave the group after 5 really brilliant years there. Liked it a lot. Also, the conference series that you may be familiar with. First, it was called Undoing Aging, and the last two instances we called it the Longevity Startup Summit in Berlin, usually in springtime. So after this, I was taking a break, really thinking about what to do next, as you may also do when you think about the next career step. I think you need a lot of time to do that. Speak with a lot of people, go out of your comfort zone, or maybe do something completely different than you have done in the past. And the best ideas, in my experience, come only after a couple of months. Really realize where to go next. For me, and this was also mentioned at the beginning, my decision was to start my own venture capital fund. RegenEra Ventures, it is called, and there's already a web page up there, very rudimentary yet, but we have a couple of weeks that we did fundraising already. Far too early to tell anything. Of course, everyone tells you that the market is horrible currently, but yeah, we will pull it through. We do not call it longevity, I have to admit. We avoid that term because what I realized is that there are like two camps out there. There are the pure longevity people that often remain amongst themselves and try to finance things early on and will not get the needed follow-on financing later on by institutionals, by large corporate VCs and others, because they insist it has to be brain replacement or whole body partial reprogramming. I'm not belittling these efforts, don't get me wrong, but it's just something that may remain uninvestable, sorry to say, for many years to come by the big investors. And I've learned a little bit the hard way that we need them. We need to unlock the floodgates of conventional capital if you really want to be successful in having not just a better version of rapamycin, not just the optimal supplement strategy that extends your life a couple of years. If we really want to have breakthrough treatments, we need to get the buy-in. And this is not a pipe dream. I know pharma has the reputation, and rightly so actually, to just develop incremental innovation, to favor the low-hanging fruit. But I've worked there. I was at Novartis, and these are people too, you know. They also get bored if they have to develop yet another blood pressure medication, yet another oncology drug that just prolongs life for 3 to 4 months. That's actually the average of over the last 10 years. It's quite disheartening. So we need to build a bridge, my conviction, between, how shall I call it politely, the hype camp in a way, but there are pearls there, you know, really good teams, really good science, and this is key, and the conventional capital. And it's really warming up. In my hometown, where I currently sit, Basel is the headquarters for Novartis and Roche. And guess how many people Novartis already employs in a group that is called Diseases of Aging? It's over 120 people already. This is quite a commitment. Boehringer Ingelheim has made regenerative, they call it regenerative medicine, one of their focus areas. Eli Lilly has approached me directly to speak about longevity. They even used that word. And there are many more, AstraZeneca, Regeneron, etc. So I think the time is ripe, but we need to adapt the narrative, speak their language, science, accepted regulatory endpoints, accepted indications, and also maybe another caveat or remark here. I do not share the optimism or even the ambition to fight for aging becoming an accepted indication or being accepted as a disease. The status quo is very much ingrained and highly profitable. Pharma companies are dwelling in money. They will not budge. They need to see success cases. And that's exactly what I try to build with this venture capital fund. We're a team of 3, by the way, all based in Switzerland. And yeah, that's our goal. So I'll stop here. Enough of monologue. Please jump in with questions, remark. Let's discuss.
Yeah, I'll go ahead and ask a couple questions on behalf of LongX. Um, so I guess to
Sure.
start, we have a lot of, early career professionals, students, some of our LongX fellows here. Looking
Yeah.
back, what would you tell a young professional deciding between working in big pharma, startups, or VC if they're interested in longevity science?
Yeah. I think there's a lot of merit to start with big pharma, with a large institution, because people out there, they think in labels. And if you then can tell I'm ex GSK, I'm ex Pfizer or whatnot, that helps you a long, long way. If you start your own company right out of university, it's much harder. So build your credentials, even if it's a treadmill, these large companies, but you learn a lot about the drug development process, about other things. So I think it's a good entry point. Also, if you consider VC, the second career option that you mentioned, I learned that in Europe, a lot of VCs are actually not scientists and not entrepreneurs. And I think that's a disadvantage. If you only have yeah, civil servants or accountants, etc., deciding where money flows in life sciences it's not that helpful. It's better on the other side of the Atlantic. In the US, you often see entrepreneurs who become VCs afterwards.
I see we have a couple hands raised. I think Grace was first, so go ahead.
Yeah, hi Patrick. Thank you. That's really refreshing to hear from you. I just wanted to ask whether you think undertaking a PhD and then going into industry is worth it and whether a PhD would help. Because I know you discussed just now about having scientists in VC, and you said it's important. So by pursuing a PhD first before you move into sort of analysis and industry, do you think that's something that would be good? Because I finished my master's and I'm just wondering whether I should be doing a PhD or not.
Right. Yeah. Yeah. As I said, people tend to think in labels. That's definitely a good thing to have. On the other hand, I don't have a PhD. When I finished my second degree after business administration and molecular biology, I was already 9 years in university, and I knew doing a PhD in molecular biology would take 3, more likely 4 additional years. And I had a good explanation why I didn't choose that path because I already had 2 degrees. I think there are so many PhDs out there that you can argue both ways. You could say it's not a differentiating factor. All of them out there have PhDs, so why should I do it as well? However, maybe it's also an argument to do one so that you're not seen as a lesser um, employee in the end for some organizations.
Yeah, thank you very much.
Yeah, I think Sungkik was next.
Yeah, yeah. First of all, thank you for your explanation about your personal story. I was super impressed about how you like contributed to the longevity field.
Thank
So,
you.
like for my self-introduction, which is a really simple introduction, I was a previous nuclear activator fellow. I previously co-founded like one startup at Rice University with my faculty that was focused on diagnostics. And I'm now like
Mhm.
trying to pivot my product into like more an AI and biofield that's related to longevity. But one of the challenges that I face among like while trying to make a product and develop it um, actually, whenever we try to start a business, like every like venture capitalist and some of like a successful entrepreneurs always say that you have to start with like very niche thing, like some of the things that you can make it as a service. By doing like CRO service for some sequencing companies, or trying to like decode some biological phenomena with like math or AI. Like they try to really
Mhm.
start from simple thing and make a service. But I feel like there are still like limitations of like making an in silico computational simulation tool as a startup who's developing at first because like they're really not heavy. Like they start from really niche and mostly the computational thing because they don't have any money to like build a lab or what lab spaces. So they build the technology. But I was curious about like when do they like start getting fundings as your investments like in VC
Mhm.
because like they are building some simulation tools and computational things, and they have to validate their technology using wet labs that their experiments are aligning with their tech experiments in the lab. But some early stage startups like don't have money to really validate those things. So how do they really overcome those things? And as you're in the VC space, can you give some examples that were really successful that you met some founders who started from niche and a really like small organization, but scaled up really in a big place. Yeah, that's my like question.
Okay, yeah. Um, well, to be fair, I never invested into tools, and I'm really a wet biologist in the end. So I did drug development most of my life, but I tried to adapt this question to what I've seen in the drug development space and getting this feedback from VCs. Of course, they say 95 times out of 100, they say no. And sometimes it's an excuse because they don't have money. Can happen, by the way. You still get invited by them, but maybe their fund is already closed, etc. This is information that is not always public, so they always look for a quick excuse. Um, what you can do, of course, is try to get non-dilutive money, grants, and other sources of money. You can try to become unconventional in the sense that you tap not the usual suspects, so to say, US and Europe. I've seen a cellular therapy company that was also struggling to raise funds in Europe. And then they went to Asia. They pitched to Singapore, South Korea, Japanese investors, and they found an investor there. So, yeah, some of them think this may be strange, and they say, oh, they already have a South Korean investor, so I do not invest in them. But you have to do everything you can. And you also have to be bold, you know. A lot of VCs send you home with a list of things they think need to be done. And don't think that they will invest in you if you just fulfill this list. So if they tell you, come back if you have mouse data, for example, you can be bold and tell them, yeah, give us the money. We put it into the budget and we'll create this data for you. If you're really convinced about the concept. So, but this minimal viable product, if I may call it like this, you know, how can I get started? In drug development, it would be like a rare disease development project. You choose the development path that has the lowest hurdle in terms of capital and try to show that your product or your drug works there and expand afterwards. Not sure whether I was able to address your question in a way, but
yeah, I think like you just like some of the questions I asked. Like, yeah, thank you for your answer. Is it okay that I can send like a LinkedIn connection for like future conversations?
of course, yeah, sure. Maybe I put my email into the chat here, then
Thanks so much. Yeah.
everyone can see it. That's my private one.
Thank you.
Yeah.
I think Dylan was next, so go ahead.
Sure, thanks. So I have a bit of a connection with the more radical, uninvestable kind of side therapies that you talked about. I've got a conversation
Yeah.
I've got a conversation with Jean Hebert in about 4 hours. So yeah. Although I suppose he's done well in being picked up by ARPA-H, better than the vast majority of these therapies do. But anyway, I've seen a lot of kind of tendency to try and rely on high net worth individuals in these kinds of communities because they've realized the same thing that you have, that it's really just not appealing to regular investors. Do you think that's folly? Do you think that a few of them might hit like Calico level Altos funding there? Or do you think they're grasping at straws there to try and rely on HNWIs, as they call them?
Yeah. You know, I'm grateful for these high net worth individuals and family offices that do the first financing, but they have to be open to future development changes. There are some high net worth individuals out there who fear that what they finance initially will get bought. Maybe they create some exciting data and then in their eyes corrupted, you know, because the initial indication, as just discussed, may be very tiny but still profitable. But there's longevity potential behind that. So in the end, you may just get a eye disease drug, and the acquirer, if it's really a successful exit, decides to dash the other programs. So in the end, you have financed something with longevity in mind, but in the end, it just bears a normal drug in the end. However, I would say this is a good outcome. You know, you can tell people this is a success case. Investors X, Y, and Z, they put in this amount of money, and in the end, it was sold for that amount of money. That's what the people want to hear, you know. And we need the big guys. Even high net worth individuals are not able to finance, clinical trials for many companies, maybe a single one or so, but it gets so large that, you know. And I think you also asked about Altos and Calico. I think these are really exceptions, and Evolution maybe also. And this will not repeat itself quickly. And whether they are successful or not remains to be seen. Calico has a lot of question marks if you listen to the market, and
Yeah, I think the same.
Yeah.
Hannah.
Hi, thank you for your talk. Thank you for sharing your experiences. It was really inspiring. So I want to ask
Welcome.
what kind of skills or experiences would be most useful if I wanted to build a career in longevity and if I'm interested in science communication as
I didn't get the question.
well. Yeah. So I was asking what kind of skills or experiences would be most useful if I wanted to make a career in longevity as well as I'm interested in science communication.
Yeah. Do you have a degree in science, obviously?
Right
Or
now I'm an
you do
undergrad.
science?
I'm graduating next year.
Yeah.
Uh,
I think there can a
uh,
lot be done. And you may know Phil Newman and his organization, Longevity Technology. This is a very good science communication, I think. And you can influence maybe decision makers because a lot of people that were successful, that have money, that could change the field, they are hidden. They are behind circles and circles of advisors. However, if you have a good communication, a good PR, I think you're able to get through them. We know of some celebrities out there that they are clearly interested into longevity, but you will never meet them. It's hard to get to them. The only thing you can is reach their advisors, which then block and say, this is not serious, etc. So I think you can make a difference there by reaching them.
Thank you.
Sure.
I suppose I'm gonna go next. Well, thank you so much, Patrick, for this. Hope you can hear me properly. But my question
Sure.
is just how did the VC industry change between when you first joined and now? Because you've probably passed a lot of cycles of evolution of the industry, and I'm super curious about how it changes because it's such a fast-paced field.
Right, that's a good question. Let me give you three answers. One is not even to your question, but is historic. Venture capital has actually been invented, if you want to call it like this, in the last century for tech companies, and it worked very well there. And then it was, this is my opinion, then it was just taken over for life sciences without changing much. And I'm not sure whether the current model, but it's fairly unquestioned, is the right one for life sciences. We spoke about the 10-year horizon, etc. Is that the right one? And the entry levels, etc. Now, the second answer would be how it changed since I entered for the things that really matter, not just the incremental innovation, but drugs against the diseases of aging. When I entered, it was practically non-existent, 2006. When I joined Kizoo 2018, I felt like the 2 years at least working for Michael, one of my main obligations or responsibilities was to protect him from cases that, let's say, they are not solidly grounded in science. A lot of people smelled, this is new field, this is new hype. And I sometimes read between the lines that there are some groups out there that want to get rich quick. Let's put it like this. And you could see this. They cited data that was not even their own, and the business plan was unrealistic. They promised to develop a drug in 3 years instead of 10, and all these things. And you can be quite optimistic, but some of the cases were, a clear no, to say this. And now the third answer, that venture capital, like the whole stock market, like a lot of things, comes in cyclical movements. And currently, we're at a very deep trough. There's usually like a 2, 3 to 5 year cycle. And the COVID years, 21, 22, maybe also 20, starting there, was very, very good for biotech financing. A lot of money flew into that space. And then 23 and 24 was the antithesis of that. Most companies were struggling to get finance, had to rely on their existing investors to survive and all that. And just when people thought, 2025 will be much better, the whole Trump thing started with spreading a lot of uncertainty and tariffs, and people didn't know anymore, is the US even a reliable business partner anymore? Can I invest there? And maybe to just share a little bit of my first fundraising experience now, establishing a fund. LPs, the ones, limited partners, that stands for, the ones that can invest into a fund, they see currently money flowing away from the US just because of the uncertainties. And not only money will maybe come to Europe, definitely not China, maybe also Southeast Asia, not only money, but also people. So it could be that the next 4 years, for those people who have to make a decision, others will just sit it out, I guess. They may also seek jobs in science, in finance, in Europe. So it could be quite helpful for the European field. This just as a short interjection.
Mel.
Thank you so much for your time. Am I audible?
Hi there.
Yeah, okay. So you mentioned how geography can often limit you. So as someone from Pakistan, like completing their bachelor's and like with a master's program contingent on receiving a scholarship, how can I effectively contribute to this field of longevity research in my home country where longevity is not really focused on? How can one start in the field, or how can one head start?
Is leaving the country an option, if I may ask? Or would you like to
Yeah, it
establish?
can be. It
Yeah,
can
yeah,
be, but I would really want to contribute back.
yeah, yeah. Um, yeah, I mean, you could start with advocacy groups, just to spread the idea that this is feasible, that aging is really a process that can be influenced. Then I don't know how strong your scientific institutions are in your country. Maybe get a degree there and help the field like this. Um, However, science is global in the end. So if you have the choice, I would prefer a degree from a good name. I again come back to this label idea. I really think people are very easy if they read Harvard, if they read Stanford, or I don't know, Oxford, Cambridge in Europe. It's just a huge help in the end.
Okay, thank you.
You're welcome. But it's tough, you know. I have some connections to Japan, and Japan is a very risk-averse country. But there's some people there, but I recently had a call again. Even they say it's pretty much helpless, you know. They have such a culture that losing other people's money is impossible. But actually, that's what you do if you do venture capital. You accept money and you risk losing it or part of it and going back to them and say, sorry, I out of this 100 million, I made 70 million. And if you have a culture like Japan, it's just, yeah, you don't do this twice, I guess. But the Americans just say, oh,
Mm,
okay,
I don't
yeah,
mind going, yeah.
to Japan.
I mean, I don't mind going abroad for education. No, no, no. For education,
Right,
I
yeah,
don't
yeah.
mind going abroad. But the thing is, yeah, I do want to see that this is just like a country that is just neglecting longevity, and it will just set us back for a lot of decades. So I just want to make sure that I can contribute something. So, but yeah, I
Right,
think
yeah,
that's a good approach.
yeah. I guess Denise also has some answers to this question with her experience there. I also think, by the way, I'm biased, of course. Switzerland is a very good country for this purpose.
Aaliyah.
Patrick, thank you for all the information that you shared. It was really nice of you. Um,
Okay.
I have a question. If you could do your career again, all over again, do you think you would spend a little bit more time on the actual core science of things, before jumping into business side? Or do you think it was a good idea for you to just kind of take them both together and a little bit more focus on the business side of things?
Right. Maybe even the opposite. um, you know, I planned already my PhD, and I can tell you now, it was planned with Tony Viscove, who is quite a force in the field. He's also Swiss. That was the reason initially. But I could already see where this would lead. It would just be a title, 3-4 years of a single pathway in Alzheimer's disease, maybe APP processing. That was the protein that we analyzed, obviously. And I was already back then, I was questioning the additional value that you bring. The most you learn, sorry, that's my opinion now, just is how to publish results in a PhD. Of course, you create data. Of course, maybe you discover something completely new, and there is the occasional case of luck, like David Sinclair's postdoc who was able to regenerate the optic nerve of a mouse or so. That's brilliant. But I think science is something that you can pick up even as a finance guy. If I would do something different, it may be the order of things I've done. Maybe I would have started with science directly at the age of 20 and not later on as I did with 24 or so.
All right, that makes sense. Thank you.
You're welcome. And I think, by the way, this answer also depends on the cultural context. You know, the answer may be different for a European woman or for an American woman or so. I think you need to consider these things. What is the best career choice? Just because I did it or someone else doesn't in no way mean that it's the best thing to do.
Yeah, definitely.
Okay, I have one more question, and then I know we're getting close to the hour, so I think after that we'll wrap up. But my question is, over your time in venture capital, what patterns have you observed that distinguish biotech startups driven by hype from those that go on to build lasting value? And then are there any common indicators that you look for in companies?
Yeah. One thing I have to mention is investors, like so many other industries and people out there, are lemmings. They follow trends, whether it makes sense or not. So for about 8 years or so, it was oncology. Everything was about oncology as soon as the checkpoint inhibitors got approved. The last 2 or 3 years have seen a huge surge in ADCs, antibody drug conjugates. And of course, you can't avoid this, obesity drugs, right? So everyone is running into that direction now. It may not make sense because if you're a pharma company entering this field now, because, we also have to do something in obesity, it may be too late. Because when you have a drug on the market, which may well be 10 years down the road, the field may be completely different. But I think that's unchangeable and human nature. Investors will follow trends as well. Now you also asked which ones will survive. I think there are two aspects to this. One is you need very solid science and not shift suddenly. I've seen a lot of companies suddenly sending me a news when COVID emerged. Oh, we also have something in our pipeline with anti-infective efficacy. I said, really? You've been an oncology company like 2 weeks ago or so. So don't pivot, rely on your science and pull through. And the second one is to have a strong management team that is able to sell the story. A good CEO is a slight overseller, I think. If they tell the investors in 2 years or so we will reach this and that, it's always a blue sky scenario. And again, the cultural remark, if you're too cautious and you present your case in the US, you will get shut down because everyone else is so much louder than you are. So overselling is absolutely okay there. In Europe, it's maybe a little bit different. You need to be more cautious. And I've seen a lot of companies that come with a business plan that was for US standards normal, looking for a 15 million Series A, say, for example. And then he presented or she presented to European investors and they said, sounds interesting. What could you achieve with 6 to 8 million? Like about half. Okay, I go back and rewrite the business plan. So this is another maybe point why some companies survive. If they are flexible and don't think that there's one presentation that you can give to everyone, tailor it. Whether you present your project, be it in drug development, be it in diagnostics, wherever, know thy enemy. Look who you're presenting to. What have they done in the past? Have they had a success case in neurology? Sneak something into your presentation that addresses neurology. Yeah, know them before you present to them.
Yeah, thank you. I think we have one more hand raised. So Nick, go ahead.
Yeah, thanks very much, Patrick. This will just be brief. So from a European perspective, I guess, from an investor standpoint, what do you think about Canadian startups versus like US? Because oftentimes we're lumped in together, but there's fairly different striations with regulations surrounding how we operate. But I just wanted to hear your opinions.
Wow, you got me there. Half of my family is actually Canadian from Vancouver area. But now that I think back, I've never financed a Canadian company. Although on longevity meetings, and I've been to them like 15 years or so, Canadians were always overrepresented. But also with Kizoo, and I have to admit, I've never not seen many Canadian business cases. You get all the things on your desk. But there was one nanoparticle case from Vancouver some years back. What else? One from Toronto, but I cannot answer your question. What is the difference? Now you tell me it's quite different in terms of regulatory, or I wouldn't even know that. And you're right. My apologies, but they are lumped together, yes?
Thanks very much. Appreciate it.
Thanks. Maybe we catch up afterwards and you educate me about the differences. I can learn something there.
Okay, with that, I think we'll wrap it up. I want to give a huge thanks to Patrick for, sharing all of his experiences and thoughts with everyone. And yeah, thank you.
You're most welcome. And feel free to contact me directly and let's see where it leads.